Hi, my name is Tiffany Waugh. I'm a Jacksonville State University applicant for Doctor of Nursing Practice, Family Nurse Practitioner, Fall 2017. This is a story of me. I am 35 years old and I have been married for 12 years. I have a 3-year-old son and I reside in East Tioga area of Calhoun County. Education that I have had, I graduated from Walter Welborn High School in 2000 with advanced with honors. I then attended Gadsden State Community College from 2000 to 2002, then transferred to Jacksonville State University, where I graduated in 2005 with a Bachelor of Science in Nursing. After graduation and marriage, I decided to put my nursing career on hold as we traveled for 2 years due to my husband's working requirements. Once returning home, I dedicated 6 weeks to studying for nursing boards, which I passed in June 21st, 2007. Some professional experience that I have had. I have been a registered nurse for 10 years. I started my career in June 2007 at Citizens Baptist Medical Center in the emergency department, where I honed in on my nursing skills with direct patient care. During 2013 to 2016, I was charge nurse in the emergency department, after which I became case manager for Med-Surg and ICU, which I currently hold that position. Some additional experience that I have had has been PRN status in the holding room at Citizens Baptist Medical Center and a regional medical center in Anniston, where I floated between multiple units. I maintain all required certifications: advanced cardiac life support, basic life support, pediatric advanced life support. All of these certifications are current until October 2017. Some leadership experience that I have had. As a case manager, I develop and implement individualized patient care plans by coordinating a safe discharge plan for each patient, which helps reduce readmission risk for the patients. Physicians and nursing staff rely on case management as a major resource in all the patient care plans. As charge nurse, I worked in the emergency department as a charge nurse, and I not only provided direct patient care, but I managed the flow of the emergency department by overseeing the entire department, from triage to discharge, ensuring that all medical personnel work together as a unit to provide the best care for the patients. Also, I acted as an administrative role by assessing risk and responding to and solving any issues that arose to provide a safe environment for the department. During my time in the emergency department, I acted as a preceptor for both new employees and student nurses. I would orient and guide them to the unit with the policies and procedures for a 6 to 8 week period. I also was the computer charting super user. Once we started that in 2002, I became a computer super user for the computer documentation system Epic. As a super user, nurses and staff would come to me for help with questions regarding the system. In 2013, I became an Epic certified trainer to train all physicians to the new computer system for medical, ICU, and surgery portions of the computer charting. My work in these leadership roles has helped me improve my collaborative and communication skills with physicians, nurse practitioners, and peers. It also has helped enhance my nursing skills and gain the trust and respect of the physicians and nurse practitioners, allowing them to encourage and support me in pursuing a degree in advanced nursing practice. Some projects that I have been a part of is the emergency department throughput process. The goal was to have patients admitted from the emergency department to inpatient within 60 minutes or less from the time the admit order was done. The second major one that I was a part of was the pediatric ouch list project. We transformed sections of the emergency department to be more child-friendly to help decrease children's anxiety during their emergency visit. The third major project was the Chest Pain Center Accreditation Project. We established flowcharts to map care process as it pertains to acute coronary syndrome patients. We went into the community to educate of the chest pain symptoms for the Chest Pain Center Accreditation certification. We also collaborated with a team to develop a one-call transfer system for the STEMI patients. The theory that I believe that relates mostly to me and my nursing practice is Dr. Gene Watson's theory of human caring, because it focuses on restoring health in humans. The whole reason I became a nurse and want to pursue my highest potential in advanced nursing practice. Dr. Watson's theory can be applied to my life in many different situations, but there are those few that remind me from time to time of who I am and I have become as a nurse. While I was in nursing school, my grandmother was sick and required home health services. At that time, I was able to observe the care she received from the nurses and nurse practitioner. They showed so much compassion and heedfulness, not only to my grandmother, but my grandfather as well. Because of their wonderful care, my grandmother's overall health and spirit was restored. That taught me a valuable lesson in life that I carried on into my nursing career. In light of working in the emergency room, there are so many recurring patients. Most of those patients become like family in a sense, which makes caring for them that much easier and harder at the same time. Even during tribulations, I always thought back to how my grandmother was treated by those health professionals, and I implemented that same compassion and heedfulness to my practice to ensure I provided the best care I could to help restore the health of my patients and the spirits of my family members. Some of the goals that I have for being a family nurse practitioner is one, to increase autonomy, provide advanced nursing care, and have a more collaborative partnership, and contribute to the nursing profession in a much broader spectrum. By obtaining my doctorate degree and becoming a nurse practitioner, I will be able to diagnose illnesses, treat patients, order diagnostic tests, and prescribe medications according to my patients' needs. I will be able to serve at a much broader capacity within the healthcare industry and provide a higher level of care to my patients. With the knowledge that I gained through Jacksonville State University's Bachelor of Science nursing program, I know I will be able to accomplish my goals and fulfill my dream of becoming a certified nurse practitioner with Jacksonville State University Doctorate of Nursing program. Again, my name is Tiffany Waugh, and thank you so much for considering my application.